Hi guys, this is Shalini and I'm back to you with another video. Today my topic is COVAXIN, which is one of the treatment modalities against the COVID-19 virus. So if you like the video and the content, kindly do like, share and subscribe. Also let me know your valuable comments in the comment box. So to begin with, COVID-19, it is a disease caused by the coronavirus, also called as SARS-CoV-2. It is predominantly a respiratory illness, as each one of you would know, and might affect the other organs in the progression of disease. People with COVID-19 may experience a wide range of symptoms which may appear between 2 and 14 days, and symptoms may include fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, loss of taste or smell of recent onset, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea. So a patient might experience one or many of these following symptoms. Before we move ahead, I'd like to give a brief comparison between COVAXIN and COVISHIELD, which are the widely used vaccines across the globe. So COVAXIN is an inactivated vaccine, basically a killed virus which is used against COVID-19. On the contrary, COVISHIELD is made by taking a common cold virus called an adenovirus from the chimpanzee. Sputnik V, this is something new. So we have been hearing about Dr. Reddy's Sputnik V from Russia. And the interesting news is it is approved by the drug regulator bodies in more than 60 countries. As India faces an unprecedented surge in COVID-19 cases, Sputnik V becomes a third vaccine to be administered against COVID-19. The principle behind this vaccine is it is a weakened COVID virus which is given into the host body, which delivers parts of the pathogen inside the host body, triggering the immune response. And the storage temperature is between 2 and 8 degrees Celsius, and the effectiveness is almost 91.6%, which means it is highly effective after the Pfizer and Moderna shots. So the good news is we are hoping to start Sputnik V shots by May 2021. Okay, coming back to COVAXIN. So COVAXIN, the BHARAT BIOTECH has announced the results of phase 3 clinical trials of COVID-19 vaccine candidate, that is COVAXIN, which demonstrates an interim clinical efficacy of 81%. The two doses are to be given 2 to 4 weeks apart, and the vaccine can be stored between 2 and 8 degrees Celsius. That means again it can be stored in most of our conventional refrigerators. Next is COVISHIELD, which is again a very safe and effective vaccine at preventing symptomatic COVID-19. The two doses are given 4 to 12 weeks apart, and it's safely stored at temperatures of 2 to 8 degrees Celsius. So now we are going to quickly run through the frequently asked questions by most of our patients who are getting COVAXIN. Who should not get a vaccine, or who should not get COVAXIN? Somebody who's got a severe allergic reaction to the ingredients of the particular vaccine that the candidate is getting. Somebody who has got an allergic reaction to the first dose of the vaccine, or someone who has got an acute infection or fever at the point he decides to get a vaccine. Who should get COVAXIN? COVAXIN is approved in emergency situations for restricted use in individuals above 18 years of age and older. What are the risks of BHARAT BIOTECH COVID-19 vaccine, or what we call as COVAXIN? Injection site pain, swelling, redness, itching and rashes, nausea, vomiting, fever, malaise, body ache or headache. What should you do about the side effects? The only thing that you can do is promptly visit the nearest vaccinator or the nearest hospital. What if I am pregnant or breastfeeding? You always have to understand that this vaccine has not been studied for pregnant women or nursing mothers, so it cannot be given in case you're pregnant or breastfeeding. What if you decide that you don't want to get a vaccine? It's always your choice. It's voluntary, so it is your choice to receive or not receive the vaccine. What if you're on a blood thinner or anti-coagulant? 3 things to remember. If your latest INR is within the therapeutic range, you can always go ahead getting an intramuscular shot of the vaccine. If you are on simple blood thinners like aspirin, clopidogrel, and you have stable medical conditions, then again you can go ahead getting a vaccine. But the most important thing to remember is, if in case you got any bleeding disorders, then the vaccine has to be administered using fine needle, and moreover firm pressure has to be applied over the area to reduce the risk of hematoma. But if your physician has an alternative decision that you are not an eligible candidate for COVAXIN, then you should refuse taking the vaccine. And always remember, the vaccine can be taken only if you are medically stable. Will the vaccine itself cause COVID-19? Definitely no. COVAXIN is an inactivated, basically a killed virus, and hence there is no chance of you getting COVID-19 through COVAXIN. This is one of the most frequently asked questions. Can COVAXIN provide complete safety? So I'd like to give you an analogy here. Look at the picture. COVAXIN is just like an umbrella in the rain. But if it rains heavily, you might as well get wet. That doesn't mean that you go out in the rain without an umbrella. So if you are an eligible candidate for the vaccination, please go ahead getting your vaccination shots. But you always have to remember that you can prevent COVID-19 only by social distancing, wearing your masks, and sanitizing yourselves at frequent intervals. This vaccine only acts like a cover. So thank you. I hope that you liked today's video and the content. If so, please do like, share and subscribe, and also let me know your valuable comments in the comment box. Otherwise, thank you and have a nice day.